doctor when we're sick, but a new survey shows many healthcare professionals work while they're sick.
Yeah, 83% of doctors, physician's assistants, and nurse practitioners admitted to being ill at work at least once in the past year, even though they knew doing so could put patients at risk. Many said they didn't want to let their coworkers or let their patients down.
Scary, though.
Yeah.
So this was a survey at a children's hospital of doctors. A children's hospital.
Yeah, right.
Maybe
At that point, hard.
makes it a little worse. I am always interested in why people do things that they know are bad or bad to other people. 95%, Kim said, we know this puts patients at risk.
And I think it's something that we all can say that we've been guilty of, going to work when we're feeling a little under the weather, just wanting to hunker down and get through the day. But this is a special group of people. These doctors are putting a special group at risk here. People who already have compromised immune systems. And Jason, you said it, a children's hospital.
So scary to think about.
Horrible.
You know, everybody has showed up to work with, everybody's come to work with, you know, the sniffles, a sore throat. And some of the doctors, this is what they did, right? It's the start of a cold or a fever.
But others, it was much more severe.
Some came with a fever. Now, a doctor...
Like a low-grade fever?
If you're a doctor and you're...
fever.
You're contagious.
101 and you're a doctor, like, that's a problem, isn't it?
It is, but you know, I think we all know that pressure, and it could be cultural. It could be that hospital where you're expected to be there, or people are going to be mad, or it could be a self-imposed thing. People that are that successful and that are that doctors do hold themselves to a higher level, I'm sure, so they want to be there for their patients, even if that means coming with the fever.
Well, that you could put them at risk. They could get much sicker. I know I've spent a lot
the
of
mask.
Doctors know that, though, right?
Matt knows this all now.
Wash your hands, gloves.
It's no big deal. But the problem I think they were looking at was these are people who are at the top. They don't have to check in with anyone if they do call in sick. But a lot of people, you know, they walk in, supervisor sees that they're not feeling well, like you need to get out of here. But these people, they're going in, they're operating, they're taking care of sick kids.
Yeah, who's going to tell the doctor to go home, right? That's your boss, likely.
Right.
Yeah.
But a lot of it is, you know, peer pressure. I know that was a common response in this survey, and I think that's something that can be related to any kind of profession, is that you want to look good in front of your peers, but also there is a lot of pressure to make sure you don't miss a beat at work. If you're gone one day, sometimes that can be so stressful trying to play catch up and make sure you have all your work done and not putting it on your coworkers.
I think there's a bigger issue here, right? Like, yes, okay, some doctors come to the hospital sick, but it's this idea where doctors are doing things or taking shortcuts in some cases that lead to problems like MRSA infections at the hospital, not careful enough hand washing. And they have turned around the hand washing issue, for example, in hospitals by educating doctors and trying to tell them to do the right thing. And perhaps the same could be done here with calling in sick.
Absolutely.